Hello friends, welcome to Creative Medicine. In this lecture, we will learn about
Now, parathyroid carcinoma. Parathyroid carcinoma, it accounts to almost 1% of primary hyperparathyroid cases are due to parathyroid carcinoma. So, parathyroid carcinoma is suspected if the patient has some symptoms preoperatively. It is suspected by the presence of either if the patient has either the severe symptoms, then you should suspect that there can be parathyroid carcinoma if the serum calcium levels of the patient were found to be more than 14 milligram per deciliter, or if the significant elevation of parathormone is seen, that is almost 5 times the normal, or if there is a palpable parathyroid gland. In all these conditions we have to suspect that there is a parathyroid carcinoma might occur in the patient. So it is suspected by these three main conditions. Next, in parathyroid carcinoma, if you see, the local invasion is most commonly seen in the parathyroid carcinoma, along with the lymph node metastasis, and distant metastasis can also occur. Lymph node metastasis is seen in 15% of population at presentation, whereas distant metastasis is seen in almost 33% of population. Now, if you see the diagnosis of the patient, for the diagnosis, accurate diagnosis is mainly made by the histological examination. On histopathological examination, you can see that there is local tissue invasion. On histopathological examination, you will see the invasion of the local tissue is seen along with the vascular invasion and capsular invasion, and there can be presence of trabecular and fibrous trauma is seen with frequent mitosis. So whenever there is tissue invasion with mitosis, then you should suspect parathyroid carcinoma. Then how are you going to treat the parathyroid carcinoma? If the patient has parathyroid carcinoma, because it is a carcinoma, you should resect the parathyroid gland along with neck exploration also. So here you do bilateral neck exploration is done. You will do bilateral neck exploration with en bloc removal. You will do bilateral neck exploration along with en bloc removal of the tumor is done. You will remove the tumor, and you will also remove the ipsilateral thyroid lobule is also removed. Along with plus or minus, you do modified radical neck dissection is done if there is lymph node metastasis. So in parathyroid carcinoma, we do a bilateral neck exploration with en bloc excision of the tumor, and also we excise the ipsilateral thyroid lobule with or without modified radical neck dissection in the presence of lymph node metastasis. Then reoperation can also be done for a recurrent disease or for metastasis disease, mainly to control the hypercalcemia. Reoperation can also be done. Then if you have to give a drug, we have a drug which is called as cinacalcet. Okay, this cinacalcet will actually, it is a drug which reduces the parathormone levels. How does it reduces the parathormone levels? It directly binds to the CASR cells on the parathyroid, and thus it reduces the parathormone levels. It is because it reduces the parathormone levels, obviously hypercalcemia can be controlled. So this is used in cases of refractory parathyroid carcinoma. We can use this drug which is cinacalcet.
thank you and thank you for watching.